Deep vein thrombosis. What is deep vein thrombosis? Deep vein thrombosis, also known as DVT, is a condition where a blood clot is formed within a deep vein. Deep veins are veins that are not close to the surface, hence the name. The clot can be total or a partial blockage and requires immediate medical attention to avoid life-threatening complications. The clot typically forms around the valve where blood pools and forms the clot. Pathophysiology. In the event of DVT, the cells surrounding the clot become rapidly hypoxic, which means they no longer have oxygen heading to them and reduce their oxygen amounts. Clots can restrict blood flow back to the heart. Short-term effects. In the event of DVT, the blood clots can dislodge and block blood returning to the heart or the lungs. This can cause myocardial infarction, a pulmonary embolism, which is a blood clot that forms in the lungs. A myocardial infarction is also known as a heart attack, or an ischemic stroke, where there's a blood clot that gets lodged in the brain, which does not allow oxygen and fresh blood to reach the brain, causing brain cells to die off. Some long-term effects. Long-term effects range based on the severity and the completion of the blockage, whether it was a total blockage or a partial blockage. These complications and effects often are pain, depending on how big the blockage was, skin changes, such as developing severe itchiness, redness, and dryness, lots of swelling around the site that had the DVT, and in severe cases, ulcers can be found. Some common symptoms are stroke-like symptoms, headache and blurred vision, high or low levels of pain on one side, often on the side where the DVT was found. Redness, and veins can appear to be moving toward the surface, veins that aren't typically there. Some common risk factors can include having cancer or receiving cancer treatment, pregnancy or going through the process of childbirth, obesity or immobility, living a very sedentary lifestyle, autoimmune disease, such as issues with the heart, lungs, and age. The Mayo Clinic often says that being over 60 increases the risk of DVT, but it can happen at any age. And smoking, because smoking affects how your blood goes through your system, specifically nicotine, affects how blood moves through your lungs and through your heart. Treatments. DVT is often treated with anticoagulants. In rare cases, they can perform a thromboectomy where they remove the section of the thrombosis from whatever part of your body it's in. Compression stockings are often used to help stimulate blood flow, and a lot of lifestyle changes such as quitting smoking, increasing mobility, and not living such a sedentary lifestyle. And here are my references.